Slak. Now, fall is coming, the weather is changing, kids are back in school, and what comes next? They catch a cold, which they share with you, and then they start having ear infections. So, as you know, we see a lot of children, and one of the things that we really, that is like run-of-the-mill thing for us is to see them coming in with ear infections. Particularly problematic are infections that recur. So here's the way it happens. They have an ear infection, they get an antibiotic. Then they get another infection, they get another antibiotic. They get another infection, they get another antibiotic. Now, by that point, those antibiotics are starting to mess up their digestive system. That's a problem. You run this over a period of months, and before you know it, they're talking about, hey, let's put some tubes in those ears. Now, putting tubes in the ears is, somewhat of a temporary fix. It doesn't fix anything. And it's major surgery. You have to put the child under. What if there was a way to avoid this whole cycle? Chiropractors don't treat ear infections. We don't treat infections. We don't prescribe antibiotics. Antibiotics treat infections. They work for that. However, when it comes to ear infections, they keep recurring because the problem that creates the ear infection, that creates the terrain, that creates the fertile ground for those ear infections to recur is not solved. Oftentimes, properly applied chiropractic care for those children, gentle, safe, effective chiropractic care, can solve that problem by solving the cause of that create that fertile ground for the bacteria to proliferate. So what does that mean? That means that let's talk a little bit about what happens when you have an ear infection. An ear infection, the ear has three components, right? There's a outside ear, the part where you can put a Q-tip in, right? The Q-tip is going to stop, it's probably going to be painful when you hit the tympanic membrane. Now, between that and the inner ear, which is also closed off, there is the middle ear. That middle ear is sort of like a resonance chamber. That middle ear is where you're going to have an accumulation of fluid if there's inflammation, if there's a cold or something like that. It's just part of normal healing process. The body does that. However, if the fluid gets trapped in that middle ear, it's like anything else in the body or in nature. You put fluid and you let it stagnate. It becomes fertile ground for bacteria. And that is what an ear infection is about. So what chiropractors do, a couple of things that are really effective that solve this problem of accumulating fluid in the middle ear. First of all, the chiropractic adjustment is going to help the muscles around that middle ear that create, there's a tube that drain that middle ear that should be draining it, that gets spasms of those muscles, block that tube off. Getting adjusted relaxes that and normalizes function so that the body can drain that by itself. The other thing that chiropractors do through adjustments is that we're modifying the mechanics and the posture. We're modifying how the neck is moving. We're helping normalize the process. We're making it return back to what it should be. And what it should be results into natural drainage. Now, when you drain that swamp, that fertile ground for bacteria, the bacteria can't grow anymore. And you stop having this recurring downward cycle of ear infections to tubes to messed up digestive tract to messed up immune system in the long run that creates all, it's a really undesirable long-term outcome for those children. If your kids, or if you know other kids who have ear infections and chronic ear infections, it might be a really smart thing to look into whether that's a problem that can be solved, an issue that can be resolved. After 30-some years of practice, we have seen hundreds and hundreds and hundreds of kids with problems like this, and we've helped them. The great majority do wonderfully well. And, it's all natural, it's safe, and it's pretty quick, too. So, for our children's sake and their future health, and their comfort right now, and so you can sleep at night because they don't have fever and crying. You can go to work because you don't have to stay home with them, and you don't have to give them pills and drugs that are going to have long-term consequences, side effects. Check out chiropractic for them. It's really, really a great option. I'm Dr. Jean-Marc Slak in Burlington. I can't wait to see you.